So welcome everyone. Thanks for making it on a Saturday evening and in the middle of the match. Um, I'll quickly give us a recap of what we've done in the past, the 3 meetings that we've done. First, we started to talk a little bit about what is evidence and why it's important. We read papers about um, how evidence is generally looked at in education and how it's not. And we delved into discussion about that, and then we went into more details of what should we do before we start planning the implementation of a program. How do we design a program? What are some things we should do before we decide what kind of an intervention is needed and how it will be implemented? So things like needs assessment, primary and secondary research, developing M&E frameworks, and also a little bit about um, how there should be emphasis on not just the framework, but also continuously collecting data and acting on those insights. We also then talked about what to do after a program. What are some hygiene checks to make sure the intended outcomes of the program are being met, and if they're not, to put in place a structure to help us iterate programs, reiterate programs from data. So we've talked about these, and we've gone through resources that help us understand these more in depth. Today, we had planned for someone to come and share their expertise about using evidence, because in our previous calls as well, we have seen this before. We know about the challenges that come up, especially when you're working with stakeholders that might not have the time or interest in investing in evidence and that process, which tends to take a lot of time. So this was one of the many challenges that were brought up while we were discussing all these different pieces to make our interventions better. So really looking forward to hear from our guest speaker today. So I'll quickly go ahead and introduce him. So everyone meet Michael. I'm very excited to introduce him. Michael spearheads the strategic engagement and outreach efforts in the Evidence to Impact Collaborative. And he's also a professor of social sciences and public policy at the Pennsylvania State University. In his role, he has touched different sectors, not just education, but policy, philanthropy, business, in a diverse range of topics like health equity, substance use and addiction, and also the societal impacts of COVID-19. So he has a wide array of experience in incorporating evidence into social impact work. And today, Michael's here to share his insights on the invaluable role of evidence in the social sector. Also the challenges that he might have faced and the things that he's learned from so far. And we're really excited to learn from that in incorporating evidence in his work. And of course, to answer all of our questions. So without further ado, I'm going to give him a warm welcome. I would ask everyone to clap, but we're on Zoom. So I'll just invite you over to start speaking. And I'm going to stop sharing my screen so you can take over.
Great. Thank you so much. I could tell, I could feel the cheers, the clapping from behind, yeah, from coming through the airwaves there. Nice to see everyone. Thank you for being here today, and I apologize for double booking on an important game day. So hopefully we can keep this interesting and we can double dip as much as we can. But I'll share my screen here and start my presentation slides. All right. So does everyone see my screen there?
Yes.
Oh, great. Can everyone hear me all right? Perfect. Okay. Well, thank you, Ria, so much for the wonderful introduction. I think Surindi, you've got your unmuted there. Oh, there we go. I am Michael Donovan, so thank you so much for that introduction. I do have one additional title to add because as many of you are coming from from academia or adjacent to it, or at least have training in it, you know that titles are they come in many forms and different roles. And actually, this is part of my work in trying to be as cross-sectoral and integrated in different groups as possible. So in addition to being the associate director of the EIC, which I'll talk about, and the assistant research professor for social science public policy, I'm also now the director of international partnerships for the Edna Bennett Pierce Prevention Research Center. So you'll see some of the work that I discussed today has a very strong prevention science orientation. So the broadly speaking, the aspiration to divert negative social outcomes, negative health outcomes, a variety of different outcomes, and promote positive outcomes. So I can go into some detail there, but it's such an honor to be here today with you all. So one thing I want to be clear about today, and Ria kind of gave a good start to it, is that I'm really going to be stepping a little bit out of the education domain specifically and thinking a little more on the system level, a little kind of meta in the evidence orientation. Because as Ria mentioned, I've done a lot of different things in different kind of policy domains. And one of the big areas that I want to talk about today is about what's been going on in the U.S. And other international contexts that I work in around the broad discourse of evidence and evidence use and evidence-informed decision-making. And also really focus in particular on the relational side of evidence use at all levels of decision making. And really important to this, and really important to the field of prevention science as well, is that I'll be focusing on how programs that support academic outcomes, such as social and emotional development, in a variety of different educational settings, can lead to really lifelong benefits for students and broader economic benefits for society. So trying to get at measuring some of these broader spillover effects into different systems. And key to that is really the world of prevention and also the world of evidence use. I come at this from a little different direction because as Ria mentioned, I've got a little bit of a different history for a traditional academic. I spent about a decade in Washington, D.C. at the Obama White House, serving as special assistant to the president for a lot of planning and decision-making there. So the real takeaway for me was that there's work to be done, and we can better improve our decision-making by leveraging an evidence base. So I come with it not from the silo of academia, but thinking of it from a practitioner's perspective as well. So EIC, so I'll talk a little bit about who we are and what we do throughout the presentation, but we are a transdisciplinary center that is focused on improving scientific impact through the development of strategic research infrastructure, systems transformation, and partnership building across sectors. Down below, you can see some of our traditional partners, both from the traditional kind of U.S. funder base. So part of my role is in the College of Health and Human Development. So we do have a big orientation towards the National Institutes of Health and the National Science Foundation, along with Centers for Medicare and Medicaid Services and a variety of other federal organizations here in the U.S. I'll talk about some specific projects later. But we also really care about taking in a broad conception of what decision-making really is. So we bring in perspectives and thus projects related to a lot of philanthropic organizations, foundations, and a variety of different groups. So we do a lot of work with William T. Grant Foundation, Arnold Ventures, Chan Zuckerberg, and one large one that I don't have on there, but because I'll be discussing it later, is the Ewing, Marion Kauffman Foundation, where we do a lot of work on entrepreneurship and entrepreneurship policy related to minority and female-led startups. So I'll talk about that as we go. But kind of in a thrust of what guides us, what are our values, and what's the point of our organization. So we really believe that there's a responsibility for the scientific community to actively engage and improve scientific evidence, obviously, but improve the relevance of it, to demonstrate the value to a variety of stakeholders, including decision makers, and try to bridge that gap. So we see that as breaking down the ivory tower of academia. We really try to prioritize scholarship and partnerships that look at the needs of decision makers and aim to maximize that impact. So it's kind of a bidirectional orientation. We're really focused on how we can do better for our end users. And most importantly, which I'll tell about quite a bit later on, is about how we can actually empirically study and replicate this at scale. So that's a key piece to this as well, that this isn't just a collection of best practices that you could do to make your rigorously derived outcomes be consumed, but also how do we know how to do this better on a system level. So in addition to this, we see that there is, and this is some of my history in working in government, really a paucity of consistent use of scientific evidence. There's a lot of directionality that says, we're doing it, we're looking at the best science, we're looking at what the academic community and the scientific community says, but in reality, there's a big disconnection between the research agendas of the academy and the broader research community and what's being done in decision making. So in the American experience, we can think of this in the executive branch as well, but I'll talk a lot about our work in the legislative branch. And key to this is thinking about how we can extrapolate some of these best practices into other forms of government, other systems of government, and international and supranational settings. So a real key tenet to this work is that decision-making, we need to recognize that decision makers' value in the use of scientific evidence can be improved by making it more relevant. So I'll get to that as we go further. This is our building in Pennsylvania. So I say here, but I'm actually in Basel, Switzerland. For those of you who haven't been here, I'm based here now, kind of focused on my international role as well. So it's not exactly 6:30 in the morning for me, thankfully. It's a little more reasonable, noon, 12:30. But this is where we're based, on the campus of University Park at Penn State University in Pennsylvania. And I'll say that because in the next few slides, I'll talk about some of our kind of physical infrastructure, which does play an important role in this. So I've kind of discussed this already, but our mission is really oriented towards increasing relevance, increasing value, and then improving and making more facile the use of evidence in different directions. We also provide kind of a home for inquiry around the science of scientific impact. So this is that meta-scientific conversation that is really taking hold in the U.S. in particular in many ways, and thinking as well about how we improve science translation. And this is agnostic to domain. So we do a lot of work in child welfare and kind of health and oriented domains, but education is exactly an area that we do quite a bit of work with. The Chan Zuckerberg Foundation and the Spencer Foundation in particular are education-oriented projects that we work with. So just a bit kind of on each, the structure of our organization. So we have 4 kind of key infrastructures, we call them. We have about 50 staff that are all across the country in the US. I'm the only one international at the moment, but we have really been benefiting from a existence that was remote and distributed already. So that allowed for a little easier transition into pandemic times as well. But I'll talk about each of these in turn, and I'll talk about kind of an example project from each one, with specific focus on the last one, the research translation platform. So this is a lot to take in here to consume. So this is kind of just a logic model of a lot of our work. So we try to think of theory of change and imbue that into our daily work. So the inputs and resources coming from the left side here into our core activities, and then that's kind of extrapolated out to the proximal, intermediate, and distal outcomes. But I bring this up because I want to just showcase a few things that are important. and most importantly, looking at the intermediate outcome section, you see we're aiming to increase the conceptual use of research, the instrumental use of research, and the structural use of research, while at the same time aiming to decrease the tactical use of research. So what does that mean? So tactical use of research in the broader evidence literature is sometimes called strategic. It's confusing as well. Sometimes called political or symbolic use. It goes by many different names, but it's really leveraging evidence to justify the pre-existing preferences or actions to explain a particular position. So it's often disparaged by researchers because it is it's really on a tactical level and not positioned in a way to deeply understand and understand and utilize it in a conceptual way. So that leads to the conceptual use. Conceptual, or sometimes called enlightenment use of evidence, is when evidence changes how someone thinks about a problem and questions what they ask about a particular problem. So it really kind of goes to the root of decision making and critical thinking. It's leveraging a conceptual orientation towards this. So that's our ultimate aim, along with instrumental use. There's a variety of different other types, but thinking of instrumental use as something to solve a specific problem. So we're going to that's often our the front door into a lot of our conversations with the research and policy collaboration, which I'll discuss in a bit. They have legislative members or policymaking communities have questions about a particular challenge, and we were able to provide them with that kind of support for instrumental problem solving use. So I bring these up just because I want to showcase kind of the piece of it here. Another piece that's not shown here, but it is also kind of a win that we want to think about, is the imposed use. So imposed use of research is when by statute, by regulation, by bylaws, by any sort of structural rationale, evidence is utilized more than it isn't. And while that isn't necessarily the conceptual use that we're trying to get at, that really is the foundation of the use of research evidence, it's also an important area that many laws in the U.S. have been aiming to improve. So so imposed use is not necessarily a bad area as well. So I'll bring all this up a little bit later as I talk about some of our outcomes in our randomized control trial of Congress. So the first cohort kind of is thinking about what the Administrative Data Accelerator is. When we were really starting this about 6 or 7 years ago, we were thinking through that, in order to facilitate impact, we really need to have a home for some of this sensitive information, right? So we're working with populations that are particularly vulnerable, maybe child welfare recipients, Medicare and Medicaid recipients in the U.S. context, substance abuse, substance users and abusers, and families who are just particularly vulnerable. So we really take very seriously the storage of sensitive information, as well as the whole process around it. So we're very meta in this respect, that we're trying to make more facile the ingestion of sensitive data, the linkage in a safe environment, and the proper utilization. So Penn State has all of the structures in place that you'd imagine from a typical highly research-intensive university. So over $1 billion in research expenditures every year. So there are institutional review boards, there are human subject research experts, there's sponsored programs, expertise, extensive counsel and privacy partners that we can rely on. But our job is to try to make this more easy a little bit, like to make the process better for the average researcher who might engage in this. Because any large organization is going to have bureaucracy and challenges to that, to making things more efficient. So that's a lot of the work we do in the Data Accelerator. We're able to work with researchers to bring in new data, to employ probabilistic sort searches and linkages across a variety of different crossover populations, whether they be in like the child welfare system, for example, or education systems. We work very closely with the Pennsylvania Department of Education on a variety of projects. But this is this kind of shows the reality of the trust building it requires to showcase that we will be good stewards of this information, and how to make sure that we do that right. So keep going here. So this is another thing, not for you to really consume, but just to take in that, that we really take into account all of the dimensions of security. So for those of you who are a little more technically inclined, this is some of our systems in place for the protection of some of these sensitive data sets. So that's been a large area of development. We keep growing in that space as well. So an example of a project related to this is what we call the Idaho Behavioral Health Transformation Evaluation. So the Centers for Medicare and Medicaid Services, the public health safety net for needs-based and elder care as well in the U.S., effectively provided Idaho, the state of Idaho, with the ability to use Medicaid dollars for particular services related to substance use disorder and serious mental illness. And we are serving as the formal evaluators of that waiver to see if this is an effective use of those dollars, and for the ability to use those dollars in a different way. This is a great example. There's the logic model on the left there. A good example of where the data accelerator is really vital because of the high sensitivity of this data, right? It's federal data, it's medical data, it is related to a population of substance use disorder and serious mental illness. So this is a very important indicator of how seriously we take a lot of this kind of data privacy, data security kind of area. And this is all important related to the use of evidence as well, because it's all about building trust. The next core of the EIC is a little more amorphous, a little more theoretical, a little less brick and mortar as the enclave is. It's our Design for Impact incubator. So here we have a number of faculty who work in a variety of domains. So we employ this concept of really radical collaboration across disciplines. I have a background in political science and public policy, business, and things along those lines. We have community psychologists, we have education experts, we have a variety of different folks focused on methods and statistics as well, and more of the rigorous data evaluation side of it. We also have folks who are in design, right? So the head of this, Dr. Meg Small, went out to the Stanford Design School to be trained on a lot of these methods in the cyclical process of engaging with users in an empathetic manner, defining problems, coming up with assumptions and challenging those assumptions, and then prototyping, rapid experimentation, and recycle. So this is a big kind of human-centered design orientation kind of core, which has led to a lot of really interesting projects that might not seem exactly like how this is described. So let me put this in more concrete terms for you. This is that's Times Square. So we recently were up on Times Square for this big project with the NASDAQ Financial Exchange. NASDAQ Financial Exchange has a large scale entrepreneurial center, the NASDAQ Entrepreneurial Center there, that is really a very thriving community of over 15,000 female entrepreneurs and aligned partners. Many of the folks in this population I self-identify as BIPOC, Black, Indigenous people of color. So this organization really provides focused curricula to their members on how to improve their entrepreneurial efforts, to scale, to understand pitches, to think about really shifting mindsets and mental models for the individual communities. So we have been partners with them for quite a while now in a variety of different projects, but one in particular is around the venture equity project. So that's working with JP Morgan Chase and some other groups, really aiming to improve and reduce the barriers that exist in the flow of capital to entrepreneurs of color. So it requires a large data sharing consortium of organizations. There's a large group of these folks in the UK as well. So we have an international dimension to the data exchange. And it's been a really exciting project that we thankfully were cited in the Securities Exchange Commission annual report of the Office of Advocate for Small Business Foundation or formulation. So that was an exciting opportunity to highlight some of this work. So a lot of this work is again human-centered design, thinking broadly about how to empathize with the end user of whatever work we're doing. But it's an example of some of this work. The Fair Pay initiative as well is around getting at pay disparities for female-led and minority-led startups. The third kind of tier of this effort is the social investment optimizer. I know these names are a little silly, but we're working on them. But this really is the home of a lot of our cost effectiveness and cost benefit analysis work. So key to this work and key to I think what you've been able to capture in what I saw about what you've done already in these forums, the sessions of the learning community, is understand that much of the utilization and uptake of research evidence has a cost dimension. So we need to understand, we're not gonna have a way to empathize and connect with decision makers if we're not recognizing that they live in a world of scarcity in their decision making. So key to that is thinking about how do we actually measure economic evaluations that are for federal grant proposals that we put in, we partner with folks on. How do we optimize various intervention models around this work? So some of this is related to what I'll talk about later, the Results First initiative, which is a particular unique cost-benefit model that we leverage with a variety of partners, particularly states in the U.S., to understand basically the costs of social interventions, variety by project. So this is a little more on that. So kind of getting at the cost effectiveness of various solutions, identifying the most efficient solutions, monetizing the outcomes for a variety of programs. So an example of this, I know it starts a little obtuse, but I'm trying to bring it to an example of some of this work. This was a large body of work we did now a year or so ago, but we pulled in about 20 faculty members from across Penn State, 10 departments, 4 colleges, to examine different dimensions of the opioid epidemic and understand the costs associated with them. This was a coalition of attorneys general here in the U.S. that basically brought us together and supported the work. So we were able to effectively monetize the damages associated with the opioid epidemic across systems, because again, the integration of data across different systems in our enclave permits us to understand, well, if substance use costs associated per individual also associate with child welfare costs, how do we approximate that dollar amount? So we really were able to bring in a lot of different dimensions of this. Importantly, we also were able to present this as utilization to use in the settlement that the attorneys general levied against industry for damages. So our funding, our our approximation of damages led to the damages in the lawsuits. So that was a really valuable contribution and a good example of how cost benefit analysis and the various associated analyses can really be useful in interesting ways. And then our last infrastructure that I'll talk about, and I'll talk about in more detail because it has a lot of relevance to what you all are doing, is the research translation platform. So this is a kind of a bucket of a variety of different activities and initiatives that we have been a part of, and I'll talk about each in turn. But it's really key to translating scientific evidence for decision makers across government, industry, and practice. High relevance to what you all are doing in trying to leverage an evidence base in educational settings. We're thinking about how do we bridge the gap, which is why we have the little bridge icon, bridge the gap between these sectors, right? We're trying to understand that the decision makers writ large are doing XYZ, and how do we inform that and better in strategic ways? How do we measure it and how do we improve it? It's important to also note that, while we have a lot of focus on the government being the end user or the end decision maker, we really take seriously that this is a broad coalition of different decision makers, that folks in philanthropies drive research agendas, people in industry make decisions that impact society. So we really take seriously that there's a broad definition of a decision maker. So I'll talk about each of these in different ways, but I did want to kind of bridge this back to the theory a bit. So what really does drive our directions, it might seem like we're just doing a broad spread of different activities in different directions, but two main kind of theoretical frameworks orient us. One is Kingdon's work around policy windows, in which effectively there are three streams. This is the multiple streams framework. Three streams come together, and when they do, there's often a movement on a policy. Three streams essentially being a visible and noted problem, the identification of a challenge, a feasible solution via a particular policy or a slate of policies, and the final very important one is the political will for such an action. This is the moment, the special window that we know that research is most likely to be used, and therefore we leverage this kind of theoretical framework. Key to this as well, though, is the importance for timely and relevant information. So I'll talk a little bit more about that and how we try to bridge that gap. And then the community dissonance theory. This is the predecessor of the community dissonance theory is the two communities theory. Both of these propose that policymakers and scientists are distinct from one another in how they function, what is considered acceptable, what are the norms. And so, of course, there's a challenge in getting along and aligning these organizations and these groups. It does expand a bit more to acknowledge that there are subsets of each community, and then there are knowledge intermediaries where we like to be and be honest brokers. And I'll talk about what honest brokers are in this context. To think about knowledge intermediaries being the third group, the third thrust. And we recognize that this is the policy world is very much based on relational relationships, right? So we leverage that in our efforts. So that's kind of the theoretical framework for it. But the idea behind it is that there are trusted partnerships that have to exist in order to facilitate the transition between these two or multiple sectors, as well as the relational abilities to work in the multiple streams to get to a spot where it could be most effective. So some of this activity around this, I have a podcast that I haven't been very active with in the last month or so, but I need to get back to. But we try to really think creatively about translational research projects and products. This being one of them that provides an opportunity for folks from the academic community to engage in conversation around real world challenges with someone from a government or practitioner community. So trying to break down silos, try to understand that there are different communities come at different challenges, the same challenge in different ways. So that's a key piece of that. Another angle of that is really thinking about how this work impacts publics in important ways. And I'll talk about public impact research a little bit later as well. Another translational research project that came out of the pandemic was, our desire to be reaching out to our communities to understand, to better leverage our expertise in the academy. So this led to kind of a blog concept, a very nerdy blog concept that effectively grew to 45 different articles with 85 authors and a nice uptake across the world on trying to understand some of the challenges around different sectors relating how COVID was affecting different sectors and different disciplines in different ways. So there's a lot of good work there to check out. Another area of some of this work we do with the translation platform is around policy landscape scans and dashboarding. So some of this is almost on the level of surveillance, if you think of it, in terms of it's not on the current exactly. There's a bit of a lag, but we leverage a couple various data sources to basically scoop up legislation, committee documents, executive actions, social media, constituent communications, dear colleague letters, a variety of other sources in a variety of different forums. So not just the U.S. Congress, but in state legislatures in particular, that we're able to then get a little more granular on sentiment analysis and how things are moving in a different direction. How much is something being talked about in a different domain? So like right here, this is a query to database around the conversations around Black entrepreneurship in the U.S. And how much that is being taken up by state legislatures in social media, how much that is being introduced in different bills. So this is an important objective measure of just the magnitude of a particular topic. So we do this on a variety of different areas. So we're working on growing it in international context as well. The European Parliament in particular would be an area that I'd like to get into. But an example of this would be, this is one specific query, thinking about, the variation across states in the U.S. on the introduction of entrepreneurship related bills. So this similar concept could be done around education related bills, for example, or a variety of different topics. But you can really see the high variation between, 3,000 bills introduced in New York in their legislature versus just 30 in North Dakota. Over I'm not sure what the time scale was for this one was. I think it was the last year. No, it could have been. Anyway, I'll have to look back and see what the time scale was. But it's just an interesting area that we are able to leverage for a variety of different projects to kind of have an opportunity to surveil the policy landscape as best as we can. Then an area I want to talk about in a little more detail as well, because it's highly relational to much of the work that you're all doing and trying to get what you deem best in class education research, for example, into the right hands. This is a large scale model that we have employed and then validated with a randomized control trial and then a follow-up optimization trial, which I'll talk about the effects of a little bit in a moment. But it's really that relational model of bridging the gap between these two communities. So how do the research and policy communities connect by emphasizing partnerships? So the idea here is to make sure this is facilitating durable and meaningful action-oriented collaborations, and how to really make sure that that lasts. So some of the core values around this, we deeply value, obviously, the utilization of empirical evidence in decision making. We're aiming, as a direction, that the aim of this philosophically is to prevent social problems. We're also committed to a through line in all this work in improving equity in policymaking. There's a whole domain of our work around equity, which I'll talk about. And then it's also participation in government. So it's importantly showing that there's contributions that the scientific community can provide to governance. So really quickly, just this is kind of the I know I've had a lot of logic models here, but sorry, this is kind of our logic model and our process for this work. So effectively, we are able to have a kind of a dyad relationship. So there's a large pool of researchers, which we call the Rapid Response Network. This is 800 plus researchers across the United States, and some in Canada, and we would be very interested in growing and finding ways to expand in different directions. This is a group that self-identifies as particular expertise. So some of these folks might be education researchers, some of them might be community psychologists, some of them may have expertise in a variety of domains, right? So they may be a community psychologist with expertise in child welfare or substance use and abuse, or gun violence, or a variety of different domains, domestic intimate partner violence, things along those lines. So there's a self-identification process of your expertise, which we then are able to consume in a database, which then we're able to query whenever we have questions. So I'll get to that in a second. But that's the side of the researcher side of the coin. The legislative side as well is we have staff that will work with congressional offices. This specific example of the RCT was done in Congress, U.S. Congress, but we're growing to expand to implementation in states, a variety of different states in a new project. So there's a consultation around policy identification. What's an area of interest? Where could we possibly enter into? We go to step 2, which is querying and growing that network around what's the actual expertise that this large body of scientists and researchers and practitioners can contribute on. You go to capacity building, where you're trying to deepen that network, understand how that can have a snowball effect and recruit broader to further strengthen the number of voices that can be heard. And then you go back to the legislative community, where we provide an opportunity for a needs assessment. So we go back and say, okay, well, these are these general broad topics that you brought up, but like, what could you use evidence on tomorrow for XYZ project? Or you're trying to get the Farm Bill through, and you're interested in the nurse family partnership in the U.S. and how that has worked or not worked. We can then take these discrete questions that are kind of narrowed down, query the broader pool of scientists and researchers, and then hold number 5 rapid response meetings, which permit us to then discuss and get to another level of what's the next step. So sometimes this produces a fact sheet. Sometimes it's a policy brief. It's typically some sort of synthesis of what the broader scientific community says about a particular topic. So this could be specifically applied in educational settings as well, about a particular model of pedagogy, for example. Then ultimately, the key for this is to build durable partnerships. So this leads to strategic planning around the next steps. So if possible, we can go on to things like congressional briefings. We can go to hearings, to different events, different Hill days, and things along those lines, which ultimately, hopefully, the end goal, of course, is to imbue the actual business of legislation with a research evidence. And I'll talk a little bit about how we thread the needle here, because I was in politics for a long time. So how do we evaluate this? Standard mixed methods evaluation. We triangulate our results as best we can with a variety of different two sides of the coin here, right? Where we've got a randomization on the researcher side, a randomization on the legislative side as well. So much of this is through self-report and surveys. We strengthen that with ethnography and understanding the process and mechanisms underlying them. And then we do the observed use of research language, like that language coding that I discussed in a sentiment analysis work. So we can kind of get at things in a number of different directions, which ultimately strengthens the findings. Then, you know, this is that threading the needle piece, right? So we want to live in this world of honest brokerage. We're not lobbyists. We are not there to lobby. We're not there to promote one thing over another. We're there to promote what the science says about a topic. And that is where we are strengthened by having a large coalition of people that can focus on issues and evidence. They make ranging and non-specific, ranging and specific recommendations, as opposed to specific request for one type of legislation, for example. And it's ultimately a balancing act. So this is a challenge. This is one of this is some of the training that we provide to the folks who volunteer their time to participate in this. They haven't been trained in their graduate degrees and undergraduate degrees and other training to engage with policy audiences. So this is a challenge. This is always one where our academic partners want to learn more, because it's not easy. So talk a little bit about the outcomes from some of these trials. So, like I said, we did a randomized control trial of Congress. There's a couple papers we wrote up on this topic. And you can see kind of our framework here on the left. We had 96 congressional offices that we pulled out of the 500 some, but we were careful and very careful to ensure more than just about equal by party, and to ensure to keep things as clean as possible. But you can see on the right there, this is why I brought up earlier some of the definitions around conceptual, instrumental, and tactical value. So you can see that we had a 7.44% increase in conceptual value, and just about even on an instrumental value, but a reduction in the use of tactical value, the use of research evidence for tactical reasons. So this ultimately has been a validation of the model. We're trying to find ways to optimize this. That's why we're in optimization phase now, and an additional RCT. And like I said, we're also expanding into state level environments. So this was on the federal Congress. We're also employing this in different state houses. And then the information on the right there indicates the increase in the utilization of use of research evidence. That's URE. The increase in the utilization of language related to research by these offices. So you can see in the particularly the child and family bill area, which is where we had most of the focus of this particular RCT. We had a 23.3% increase in the use of research language in the outputs of Congress versus the control. We also exposed the researcher community to improved outcomes, because that was just a measurement really of the legislative side. But the researcher side, we also have done a careful measurement And we've seen a 55% improvement in researchers' engagement with policymakers, and significant improvement in researchers' belief that engagement benefits their research. So they're improved. They're feeling like they feel more in touch with the real world in some ways. And we also, interestingly enough, saw that the benefits were particularly pronounced for scholars identified as BIPOC, Black, Indigenous, people of color. So some of this was surrounded by the equity question. We're able to bring more voices to the table that may not be able to traditionally get into meetings with Congress, for example. So we were facilitating that in a unique way. So that's exciting findings, and that continues to grow. Again, I'm happy to provide any papers if would anyone like any further detail. So this is a domain of the RPC that particular model, where we're actually going a little deeper, right? So that was the system-wide. How does this relational model, improving the connection between these communities, improve the use of research evidence by lawmakers? Then how does that improve the outcomes or experience for the participating researcher community? This is a little more experimentation and a little more tinkering with the understanding of how we actually disseminate information. So we call it SCOPE. It's the Science Communication Optimizer for Policy Engagement, but it's a replicable enhanced dissemination model developed with the recognition that responding to policymakers' existing interests and goals with relevant research evidence should improve the reach and uptake of that research. So if we can improve the relevancy, improve the timeliness, and improve why and how exactly it's relevant, and I'll talk about our experimentation around there. But very importantly, the SCOPE model employs a continuous quality improvement mechanism to test these different strategies in order to increase the reach of research among policymakers. So we are able to employ a lot of rapid experimentation in this, which is excellent and low cost, because they're typically in email distribution. But we're able to kind of employ some techniques and methodologies in almost traditional marketing domains to understand what is going to resonate with different groups. And that's some of the dissemination around best practices. So this is the cyclical model of this. There's meeting requests or discussions. There's interaction between the scientific and the legislative or policymaking community. Generation of those fact sheets on policymakers' priorities that synthesize a huge body of scientific knowledge into a distilled version, disseminate, and then that recycles into the process. This is a little more of the specific frames and trials that we've employed, along with some p-values for showing the significance of the various frames. So we're testing these different frames. We're understanding that this is how we build an effective outreach that increases engagement, and then we're also assessing that impact. So different versions resonate in different ways. So we had personalized messages where we would tinker with the subject line or body. We also would tinker with the who was actually being sent who was sending the message, whether it's a constituent, whether it's a scientist, particularly unique human being scientist, or whether it's an organization. We framed it around personalization. We framed it around problems in particular. We frame them around racial justice in particular as well. So really interesting outcomes to see the process. But the key piece is that this is replicable, and it does have an eye towards equity. So we're aiming to amplify the voices of those who are historically excluded from policy conversations. This work has definitely shed light on improving strategies here around long-term interventions in general, but It wasn't incredibly consistent across all types of communication. So we know that some offices just were not responding. There's a high variation across offices and how they engage with constituents and non-constituents. And there's high variation across offices around how they engage with the scientific community. Unfortunately, a result of, most likely polarization, increased polarization. But we recognize that this is kind of a growing field, and we want to try to think about how to expand on it. Oops, went ahead there. So key to this, I talked about the model of experimentation on actually how these materials are deployed, but key to the deploying of these materials is making sure that they're timely and relevant, that they focus on the researcher and policymaker interactions, and that they're really consumable, right? So brief and skimmable formats, because we recognize that there's an information overload challenge for a lot of policymakers. But really important to this as well is the integration of the CQI component. So this is some of the kind of the model as well of what we employ for the CQI. And I have a link as well to further details on some of this, because I know it's I'm going through it quickly. But this has been some of the outcomes from some of the, I recognize there are limitations for sure on much of this work. The outcomes of some of these trials, particularly in terms of social media, have been very interesting. We see a 77% increase in language related to data and analytics on social media, as well as a 26% increase in that conceptual research use language, which we've done through various coding. So this work continues, certainly a growing area of effort. And we have a couple papers under discussion and review right now. This is the full brief on the CQI findings, if anyone were to be interested in that as well. We know that Q relevance matters. This is one of the key pieces we found about how we bring increase and uptick in engagement. Q relevance being the likeliness to engage with things that they deem personally relevant or relevant to their constituents. So there's an important piece there. We found that people are really are more relevant than organizations. So I mentioned that discussion of the experimentation around who's sending these messages around research evidence. People, personal narratives, establishing and maintaining relationships is key as well. That there's just a lot of variability around state officials engaging and federal officials. There's just high variability in the space. So it's an interesting area that we're continuing to experiment in. Just continuing along, for the sake of time, I want to briefly discuss a little bit about some of our kind of system-wide and community of evidence work. So putting down the research translation work for the moment, and thinking about what is the broader conversation that we're taking part in, and that thankfully we get to be driving the boat in a bit. A large part of this was the engagement with the Office of Science and Technology Policy and the Office of Management and Budget at the White House. This last year, we were able to work with them to hold a large summit at the White House in February now. That was kind of taking stock of the broader evidence ecosystem, both today and then thinking about how that is going into the future. And really key to this is understanding the through line, like I mentioned, the through line of imbuing an equity frame, an equity lens into our understanding of how evidence is generated, translated, mobilized, used, impact, and then think about how that cycle comes back. So this is a slide that I put together to think about, at what point are we thinking about these questions about who's being left out of the conversation, what is being lifted up, what research is being referenced in policies. Is inequality centered in this work. So this is another area of our efforts. This was the president of Penn State and the second gentleman, Doug Emhoff, who spoke at the event. So we had a chance to lift that up. We're continuing to work with them in a variety of different areas. So it's been a really fun way to think about the broader international and national community around evidence-informed decision-making, and increasingly the movement for public impact research as well, which we're very active in right now. So the last domain I really wanted to talk about quickly was as it relates to evidence generation and utilization, and is also particularly relevant to the education mission, is our work around results first. So this is a broad body of work that was started by the Pew Charitable Trust and the MacArthur Foundation in 2010 or so. So we have recently taken on the efforts of the clearinghouse, the benefit cost model, and a variety of different other domains that we're working on. So we were able to take on, they put their trust in us to hand over their corpus of work, and we're trying to find ways to modernize it and expand it. In particular, the clearinghouse is really kind of a clearinghouse of clearinghouses. So here, in other parlance, I know in the European experience, sometimes these are called registries. So I want to make sure that we're speaking using some of the same terms and understanding that there's some relevance here. But in the U.S. experience, it's typically called a clearinghouse, where a collection of variety of different programs are vetted for the quality of the evidence that the program has accumulated through a variety of different means, whether that's through the gold standard of RCTs or quasi-experimental processes, or a variety of different more lenient levels of evidence establishment. And then there's a rating provided pretty much of how impactful that program is likely to be. And then this work combines the evidence, combines these results from various clearinghouses. So that's why we call it kind of a meta clearinghouse, or a clearinghouse of clearinghouses. So this slide shows you some of the various clearinghouses that are included in our results first clearinghouse, much of which have programs related to education outcomes, and particularly around different stages of development. And you can see on the right there the rating system we employ to showcase the level of rigor attached to proving its evidence. The big question, of course, here is always about context. So thinking about how something could be employed, and how that evidence was established in a particular context, in a particular community. So those are some of the caveats to always say, but it is a good source of information for understanding where different programs lie. In addition to the clearinghouse, we also, like I said, have a really unique cost benefit tool that we're able to attach, basically monetize outcomes for particular programs. So the idea here is that we're able to identify programs that fit a legislature or agency's needs throughout the inventory, match those programs to the available evidence, then leverage benefit cost analyses to analyze those results, and then inform stakeholders, and then ultimately employ such decisions in how we move forward with a different program. So that's the concept behind Results First Clearinghouse. We do quite a bit of this work in various states. So I just was meeting with the government of New Mexico. The state of New Mexico just the other day, Tennessee, New York, a variety of different large states, Pennsylvania, of course. So really interesting work and really interesting area that people are really excited about. This is a little more about the evidence-based budget making tool that we employ. But like I said, you're able to provide this larger database of evidence program effectiveness. Individual states then can employ their own state-specific population information and the cost of deploying those programs in those states. The model then is able to calculate those long-term costs and benefits for each program, and then it ranks them by the ROI. That's we found to be incredibly vital information for policymakers to understand the effectiveness of a particular program. And lastly, I just wanted to extend a hand out because we are doing all sorts of work in different areas, as you can hear from me today. Lots of different projects and disparate domains. So we'd love to collaborate in any way. Much of our work is bucketed in these 4 systems, these 4 infrastructures, but they all provide different value in different ways. And then importantly, we're doing more work around mis and disinformation as well. Particularly talked about the science communication work and the policy engagement work. I particularly put a puzzle here because it's putting a puzzle together, it seems, in many ways. But yeah, so with that, I'll provide my info, and then the websites for both the Evidence to Impact Collaborative as well as the Independent Peers Prevention Research Center. So certainly welcome you to check them out, and please reach out if you have any questions or would like to chat further. That's all I have.
Thank you so much, Michael. This was a very comprehensive info, like a lot of detail about what you do, and gives us a lot to think about what we need to strive for. So throughout when you were presenting, I was thinking about how this can help us understand where we want to head, because there is a massive gap in what you're saying your organization is able to do and what we think is possible working with governments, government departments in India, in education specifically. So I have a lot of questions, but I'm also inspired at the same time, because otherwise it's a very slow process to try to bring a more evidence-informed approach into your own work when the stakeholders that you're working with do not allow for room, or the structures that you're working with do not allow for room for that kind of a thing. And the cascade really dissolves what research said. It was still like, and it gets disheartening. So this was really nice to see what's possible. So thank you so much for sharing.
Yeah, and I realize I threw a lot at you. So if there, if more questions bubble up over time as well. But yeah, I think a key takeaway is exactly what I was trying to convey is what you voiced there, that it's not that it's going so well in the US or something like that. There's different stages of development, and I think that like keeping going is a really important piece. And the real key here is how we can learn from each other to better move the ball forward, recognizing that contexts are very different.
Yes, absolutely. Thank you. I know it's 5:15 already, so I will open the floor up for questions. Does anyone have a question they want to ask Michael, something about what he presented or a challenge that you face that maybe he might be able to give some insights on? Either ways. I will begin. I'll also give everyone some time to put down their questions. But so one of the questions I knew I had to ask you today is, can you tell us some strategies for effective collaboration between researchers and policymakers? But you touched on that quite a bit. You gave us like pointers on what are the necessary things that you found in your experience to have helped with your collaboration with policymakers. But I guess like the next level to that question then is, so all of these different projects that you talked about and you gave us examples of, the state costs of the opioid pandemic and the Idaho substance use example. When you partnered with the state or the government for taking a more based, evidence-informed approach, was that an ask from them, or did you have to do the work to incite that? And has there been a time in your experience working with more evidence or incorporating evidence into your work that you've seen that has been a challenge? And if yes, how have you sort of bypassed that? Because that tends to be, I know this was a long question, so let me know if I need to repeat this, but the major challenge that I face in my work, and I work in designing implementation programs, is that it's really hard to convince stakeholders to consider evidence and not other things that should influence a program. So that's my question.
Yeah. Yeah, it's a good one. I think in regards to the genesis of a lot of projects or initiatives or areas, that is highly variable. You know, it can be motivated by just a greater need. So, you know, the effort around the opioid epidemic, for example, Pennsylvania was just happened to be the Attorney General of Pennsylvania at the time was a key player in this coalition of attorneys general, and we being Penn State being the land grant, the large research university, it was a natural attempt to kind of reach to us and to think about these questions. But to get to the end result was a much more complicated consultation, right? So there was a government outreach, but it certainly wasn't, you know, like clicking a switch, right? Idaho as well. We've have built up kind of a body of work in some of this area. So they did reach out to us about how to evaluate it, partly because they have a requirement for an external evaluator. So that's an example of imposed use of evidence, right? Because they have a statutory requirement. It still means that we're doing the right work. We're trying to employ a scientific rigor to the effectiveness of that program and that waiver. But it was a result of imposed research use. So it's highly variable. I do think there's a snowball effect that once you become a little more known for a certain effort, then if we can cheerlead each other and get our work out there and showcase to the world that this is doable, then more opportunities come up. I also think it is important to do that some of that human-centered design piece, to empathize with your end user and understand that we need to disabuse our government partners from the idea that this is just an extra step or this is a burdensome challenge to overcome to employ rigorous evidence-based in decision making, but actually we need to showcase that this is a value add to them. So that's partly why we rationalize things around the monetization of programs. because that's a direct value add to a legislature or anyone in government, right? They're trying to see that this has an ROI of 10 to 1, right, for X program, especially if you're thinking about capturing the diversion of negative outcomes. So a substance use program employed in prisons reduces recidivism XYZ amount, and I'm not saying we're defining that evidence base itself, but to communicate that in an effective way, in language that makes sense to them, especially around cost, I think really matters. I was in Bosnia for prevention science. That's actually where I got COVID last week. But I was with an Irish substance use funder for the Dublin area, and we were talking about the value of monetization, because it really does put things into a language that is relevant to decision makers. And it's hard because, especially in education research, I think to approximate with any fidelity that kind of monetization, but insofar as you can, I find that to be really effective.
Thank you. Yeah, I think we do, at least in CoLab, and I'm sure other organizations. So there are people from different organizations present on this call. So, what we do see is that, like you said, there's vast variability, and a lot of our time and effort goes into figuring out what will work for that specific stakeholder and that specific situation. Right. So, no, but thank you for sharing that. We have another question from Anirudh on the chat. I'm just going to read that out. Could you talk about how an organization may reflect on the rigor of the research process they're following? How does one ensure a balanced approach to this kind of work and prevent or deal with bias which may come in due to organizational values or team values?
I was just going to try to pull up so I can read that as well. Let me stop sharing. Where am I here? Okay, there we go. Sorry.
Ria, there's added to the same question, Soumya has also mentioned something.
Yeah, absolutely. I think that's the question of rigor is really a challenging one, and Ria, thinking about designing implementation projects, it's like, how do you balance a program being facile for employment, but also rigorous and delivered with fidelity. I think we have the benefit in our organization being attached, to a university, and being, like I said, having the rigor associated with the broader research infrastructure of the institutional review board, the peer review process. We don't have to approach the rigor question as much, because we apply a very high level of rigor. I do think there is a really interesting and important discussion to be made around what constitutes a high level of evidence, whether that is a randomized control trial, which in many circumstances just cannot be done or cannot be employed, or is not reasonable or cost effective, or whatever. So understanding that there are quasi-experimental methods that can also employ and promote a high level of rigor. So I think there is a conversation being had across the US in particular, and the UK, and a lot of the partners that I deal with pretty regularly, around having a more expansive conception of what is the gold standard of rigor. And in our field of social science, you have to be more flexible to employ different methods. So yeah, time interrupted trials, a variety of different experimental methods I think could be employed to get at the rigor question. And then yeah, bias around organizational values and team values. Yeah, that's an interesting question. I could see some dystopic orientation of an organization like ours that would then be captured by some interest and employed for nefarious means or something. And certainly I think there are plenty of lobbying firms in Washington D.C. who would say that they are evidence-based and evidence-informed and et cetera. Yeah, that's a challenge to understand the bias. I would say that we try to bring as many players into the conversation as possible. So we kind of have a built-in bias prevention mechanism by bringing in our over 800 researchers for the Rapid Response Network, for example, so that there's an understanding that there's more of a democratic process in understanding what policies to approach and how to approach it, as opposed to employing science for a negative. So I feel like all those partners that are they've elected to volunteer time with us to promote science policy and science communication. They would not be wanting to take part in it if weaponizing this in a way that was unseemly. And one thing I did was the incentive structure as well around promoting cooperation with different groups. One thing that we're engaging in more and more in the kind of meta higher ed conversation is around promotion and tenure and how we value different activities for the scientific community. So a lot of this activity that we're saying, hey, junior faculty member from XYZ university, we'd love to get a couple hours of your time every month to contribute to this goal. They're doing it out of their value for the mission and the job we're doing. But we're also trying to find ways to have that count in their career progression, because there's an equity challenge there, right? So we write letters to deans. We try to understand that this is a valuable contribution of their scientific expertise, and so that's an ongoing discussion. We're actually in a lot of we're working on right now. I mentioned briefly the public impact research concept. We're working with our president of Penn State, Neeli Bendapudi, actually, who I was in that photo there, around how to really improve how to capture impact broader than citation numbers, number of papers written, chapters edited, etc. So there's like an angle around reform in higher ed, and that gets to how do we incentivize cooperation, that cooperation being key to preventing bias as well. So that was a long-winded response, but I didn't mention that important feature of it. Yeah, and then Anirudh's question around conflict of interest. Yeah, absolutely. I think that's an important piece. That's why we employ so many people. We do have kind of folks who are super users of this, who really want to, they're perhaps in a position in their career where they can dedicate more time to support this effort, or they really want to, they really care passionately about it. So yeah, I think that's an important question to address conflicts of interest. We try to bring the team approach, like I said before, like multiple voices to the table. Ultimately, when pen goes to paper, you have to have authors. So we always have multiple authors. We always are trying to approach this. So yeah, there certainly is more work to be done around around like conflict of interest, we want to be careful that we're not putting something forward. So there's more work to be done there.
Thanks, Michael. Any follow-up questions, Soumya, Anirudh, anyone else with another question? Because I have one more before we leave. Okay. So, Srinidhi.
Hey, Ria.
Hi.
Hi. Sorry, the question was quite long to type, so I thought I'll come off mute. Yeah, first of all, Michael, just want to thank you for the extremely insightful talk and for taking the time out to share this with us. I think one of the things that stood out to me was just the specificity of the kind of things that the organization was trying to research and gather evidence on. I think a challenge that I've often faced in the education space is because the work is so complex and there are multiple processes at play. It often becomes quite challenging to establish causations and slightly maybe easier to look at correlations. But then there's also a downside to that in terms of not being able to be maybe convincing enough if you're really sure about whether it's actually worked or not. So yeah, I think just a question around how would you suggest, and in cases where it's not easy to also go to the causation route within in the kind of methods that you choose, how would you suggest an organization approaches this challenge?
Yeah, that hits the nail on the head that these are complex societal challenges, big programs that have effects that may not be as clear. That's it kind of goes to why we employ a mixed methods approach in our study of the impacts, right? So we're recognizing that independently self-report is going to be fairly weak, right? So we strengthen that with more objective measures, like in the policy surveillance effort. So I would say that trying to employ diversity of rationales to get at I also think we should maybe disabuse ourselves of the need to get to causation, right? Like I think that a strong correlation can be a valuable component too, especially if especially the recommendations are going through kind of a more democratic process of vetting to be validated. So yeah, I guess my response would be try to empathize with the end user. So getting to the point around monetization of outcomes is an interesting dimension. If causation is not able to be derived, then you could employ a variety of different persuasive techniques to indicate that this is a worthwhile expenditure, and then try to get at various other measures that are going to ultimately combine support your recommendation or your end goal. Does that make sense? And then there was a second part of the question, I think, wasn't there?
No, that was it. Yeah, thank you so much.
Yeah.
Michael, do you have a couple more minutes? There's just one more question I have.
Sure.
Okay. So one thing that comes to mind is, so most of the organizations that work with the government to enable the government or work in the public schooling system were young and just starting out. We're just starting to realize the benefits of using evidence, the importance of using it. So this learning community is also kind of a place where people who either have started incorporating various levels of evidence in their work are present, and there are some who understand the value of it but are not able to bring that about because of several systemic challenges. So if you had to give some advice to orgs that are on this call, organizations, that this is the one thing that you can start with. I know this might be like a hard question to ask you to, pen down that one thing that will be crucial to begin with as we begin on this journey of evidence. And most of us design programs, design research studies to enable programs and decrease negative consequences like you were talking about. So advice for all of us.
Yeah. No, it's good to sum things up with North Star conversation of what's the point and how do we do it. I would center everything around trust. This is all the things that we employed there were around relational models, right? Improving how two different communities engage, how we get people to read an email because we want them to read it because we think it can influence their decision to make the right decision that we think is the right decision. But ultimately, what boils down to it is trying to have that relational trust, and I think that that kind of gets at the crux of a lot of our efforts. That if you can go a long way, you can go a long way in improving the use of any evidence by being there, by taking part in the conversation, right? In taking the meeting with the government partner who might just be interested in feeling awkward when they're asking questions about how to prove it, how do you know, addressing limitations, that kind of thing. But doing the work and trying to build that trust, I think that's key to it. I mean, that's really what when we are able to make through the relational model of the research to policy collaboration, through those steps, the ultimate goal is to make a durable relationship where both parties can communicate in different ways. So I would say that. I mean, I would say that trust building is really key to this. So that's providing value to them, and understanding that you might not be speaking the same language or at the same end state right now, but you have to start somewhere.
Thank you so much. Well, I was truly inspired, and I do have more direction towards also, like, because of the gap, like I said in the beginning, that we've noticed with how long we have to go to truly start using evidence to inform decisions in a non-biased way. So thank you so much for taking the time to talk to us. This was very useful. And yeah, thank you so much. Have a great weekend.
My pleasure. Thank you. And please reach out if you have any questions or want papers, whatever. I'm happy to provide.
Thank you, Michael.
Thanks.
We'll share your contact information with the members of this community. So if
Please
they have
do.
any questions, they can reach out to you directly.
Please do. And good luck on the match.
Thank you.
Thank
It
you.
was wonderful once again meeting you, Michael. Loved every word that you said. Thank you so much for being here.
My pleasure. Please keep in touch. We'll talk soon.
Definitely. Thank you.
All right. Bye-bye.
Bye.
Bye.